Good morning, everyone. This is Jay Cabrera Jovero, together with my co-reporter, Oliver Larita, reporting Lesson 11, which is Sexual Behaviors. Our lesson objectives discuss the variety of sexual behaviors in humans, tackle a typical sexual variation, and show appreciation of the diversity of human sexual expression. Lesson Introduction. Psychology has three primary components: affect, the emotion and feelings; cognition, thought process; and behavior or actions. Hence, when used as a framework in understanding human sexuality, it is only appropriate to explore the diversity of behaviors relevant to our understanding of human sexuality. Sexual behaviors are actions that humans agree to interpret as an expression of their sexual motivations or interpretation. So, it is also distinct from although it shapes sexual orientation or one's emotional and sexual attraction to a particular sex or gender. So, example, di ba guys, kung isa ka tao ma-attract sa isa ka babae or isa ka lalaki or even in the same sex, maka-feel siya through emotional feeling like pag nasaan niya kasi nga base sa kanyang mga nakikita sa isang tao gusto niya ito. So, example na siya sa sexual behavior kanang ipakita niya through his action para ma-express niya kung unsa niya kagusto ang isa ka tao. So example, iyaha kini kanang mag hug siya or mukis sa isa ka kanang tao nga iyahang gusto or uyab niya. So mao na ang sexual behavior. Also can be typical according to the aim of the behavior, such as masturbation or stimulation of one's own genitals can be considered as autoerotic or self-directed. So kani siya mostly mahitabo sa mga legal or katong mga mag-asawa. Erotic motivation can also be directed to other people of same sex or of the opposite sex. So, ang erotic motivation, even nga same sex lang mo or opposite sex, pareha lang mo maghimo og sexual love or the intercourse. Homoerotic behavior are usually behavior oriented to the same sex. So, homoerotic behaviors connected to or causing sexual desire for a person of the same sex. So, ang homoerotic daw in humans, as a contrary to the traditional study of the topic, the emphasis is on homoerotic behavior itself, irrespective of sexual orientation. It is an perennial model drawn from cross-species evidence, cross-cultural evidence, and current evolutionary theory. So, sopak daw jud ni sa ato ang traditional as a Filipino. But still, ni exist ni siya tungod sa love sa isa't isa bisan the same sex lang sila as long as magkasinabot sila. So, sa ilaha nga matter pwede ra gihapon na kay ilaha man na wala tay mahimuan na. The heteroerotic behaviors are used to refer to sexual behaviors oriented to the other sex. So, heteroerotic behaviors having to do with sexual excitement towards the opposite sex. So, kanay legal jud ni siya kay kuan man siya both male and female, dili man siya opposite. And also called heterosexual men and women or a heterosexual couple. Men typically have sexual partners to a similar age or younger, whereas women have sexual partners to a similar age or older, men may select women for their youth attractiveness. Women may select men for their potential to supply resources. Partner preferences in later life also reflected needs for companionship. However, sexual behavior do not only refer to copulation. There are also sexual behavior that involve oral stimulation of the genital, such as fellatio, oral stimulation of the penis, or cunnilingus, oral stimulation of the vagina. Then, there are also sexual behavior involving stimulation or penetration of the anal orifice or anal sex. So, ang copulation daw is a word for sex. Is an even more scientific way of saying sexual intercourse. You can use this word to describe the sexual practices of humans. So guys, hindi talaga matatawag na copulation or having sexual intercourse kung walang both male and female na makaka-feel ng sexual attraction dahil walang mangyayari sa kanilang dalawa kung walang ganoong feelings or sexual motivates go for behind the big three or love, pleasure, and making babies. So ang isa ka couple o mag-asawa kung mag-sex sila tungod kay sa love nila ang isa't isa, so bodily pleasure or ready na sila magkapamilya or magka-baby. Sexual response cycle. For heterosexual couple, one of the stimulate goals to the sexual act is reproduction. This is made possible through the fertilization of the ovum by the sperm, which necessitates ejaculation. Release of the sperm from the human male into the internal reproductive system of the human female. Before this ultimate process, both the human male and female undergoes a sequence of bodily change which prepare them for a sexual climax. So mauna ni sila. This sequence of changes is referred as a sexual response cycle. So halimbawa ang magpartner kung gusto na magka-baby, so again, kung magbuo og pamilya, mosulod na sila sa butang nga magandang pamaraan para makabuo na sila og anak. Mauni ang gitawag nga sexual intercourse o kung sa Bisaya papakighilawas. So sa ilahang sexual intercourse leads us to sexual response cycle. So possible nga dako nga chance nga makabuo na sila og baby. Master and Johnson model years 1966 to 1970 proposed that the following are 4 pieces in the cycle. So the first is the excitement. The excitement phase is the first phase in the cycle. For the human male, goal to his phase is erection or chumsen, the elongation of stiffening of the penis, so that it can be efficiently inserted into the vagina. So mauni ang first nga himuon sa lalaki. So ang excitement na siya general characteristic. The general characteristics of the excitements are muscle tension increases, heart rate quickens, and breathing is accelerated. Skin may become flush, blotches of redness appear to the chest and back. So sa babae, nipple become hardened or erect. Blood flow to the genitals increases, resulting in swelling of the woman's and erection of the man's penis. Vaginal lubrication begins. The woman's breasts become fuller and the vaginal wall begin to swell. Magbasan. The man's testicles swell, their scutum tightens and begins secreting a lubrication liquid. The second phases are plateau. This phase is characterized by a sustained peak in stimulation of the organs. In the human male, the corona and glans penis become enlarged and reddish. The general characteristic of the plateau phase, which extend to the blank organs. First, the changes began in phase 1 are intensified. The vagina continue to swell from increased blood. The woman clitoris is become highly sensitive, may even be painful in touch, and retracts under the clitoral hood to avoid direct stimulation from the penis. The man's testicle tightened, breathing heart rate and blood pressure continue to increase. So, pusog na ang ilahang kuan, blood pressure. Muscle spasm may begins in the feet, face, and hands. Muscle tension increases. So, mauni ang mga ma-feel sa second nga sa ilahang pag-intercourse. The third phase, orgasm. The orgasm phase is the climax of the sexual response cycle. It is a stage of release wherein the human male achieves ejaculation and the human female is ready to achieve the sperm for possible fertilization. So, ang orgasm is the climax of the sexual response cycle. It is the shortest of the phase and generally lasts only a few seconds. So, dali lang ni nila ma-feel. Pero mauna ni ang gitawag nga climax. So, sa kadaghanan, ang nagiingon nila, mauni ang pinakalami nga moment sa mga nag-intercourse or nag-sex. The general characteristic of the phase include the following: involuntary muscle contractions began, blood pressure, heart rate, and breathing are at their highest rate with a rapid intake of oxygen. So, maginapas. Muscle and the face spasm. There is a sudden forceful release of sexual tension. In women, the muscle of the vagina contract. The uterus also undergoes rhythmic contractions. In men, rhythmic contractions of the muscle at the base of the penis result in the ejaculation of semen. So, mauto ang ilahang mga gidesire nga ma-achieve nila to the climax. And the last phase are the resolution. In the resolution phase, the male penis return to its normal unerected phase, whereas the testes and the scutum descend. Or during resolution, the body slowly returns to its normal level of functioning, and swelled and erect body parts return to their previous size and color. So like normal na ang heartbeat, breathing, ang nipples sa babae dili na siya hardened or erect, mabalik na siya sa normal. Din ang penis sa men dili na siya strong or dako. Og ang changes sa color before sila nag-intercourse, so mamulaman sila, so kato mabalik na siya sa normal color or sa previous color. Kaplan's model, 1979. So mo ani ang second researcher or si Kaplan. Kaplan's model since the sexual response cycle is having relatively independent stage. The three phases of this model are included. So lahi na po ni Kaplan, which is the desire, is the psychological component of the sexual response. Or according to Kaplan's model, for many men and women, arousal arousal precedes desire, the discovery of an erection, or the awareness of pleasurable genital sensation, which their sexual interest, which is the arousal. So, mao to siya. And the second phase for Kaplan, arousal phase, is the phase where the excitement and pleasure, as defined as Master and Johnson, take place. So, sa second phase, which is the arousal, dito mangyayari yung excitement and pleasure, such as sexual touching or visual image. Arousal is expressed the erection of the male to vasogestion and mitonia in the female. The last phase is the orgasm. Orgasm in Kaplan's model is generally similar with that of the Master and Johnson model, except that this phase also include the resolution phase. So the reason why Kaplan's not include the resolution phase, because Kaplan phase refers to the psychological changes that are produced when sexual arousal subside and when return to their pre-sexual state. So pare-pareha lang sila og model, but sa resolution lang sila nagka-lahi-lahi. And that's the end of my presentation.
Good morning, everyone. I am Oliver Digamo Larita, and now I am going to report about my assigned topic, sexual response dysfunction. Sexual desire disorder, when an individual has low sex levels of desire or has an aversion to sexual activities. Sexual desire disorder, it is because absent or reduced sexual thoughts or fantasies, no initiation of sexual activity, absent or reduced sexual excitement or pleasure during most sexual activity. Reduced sexual interest or arousal in response to internal or external cause, such as partner attempts to initiate sexual activity. Sexual arousal disorder, when an individual has problem in achieving necessary physiological state for copulation, erectile dysfunction, milk. Sexual arousal disorder, people get arousal disorder because of sexual difficulty. Can happen for many reasons. Some of these are emotional in nature, such as stress and anxiety or problems in relationship. Behavior factors like alcohol or smoking could also to be blamed, as could certain medication. Orgasmic disorder, when an individual has problems in achieving premature ejaculation among male and female orgasmic disorder. Sexual pain disorder, when there is an experience of pain during the sexual response cycle. Orgasmic disorder, it is when a woman either cannot reach organs when she is sexually excited and sex is not enjoyable. It can become a chore instead of satisfying intimate experience for both partners. It is poor communication about sex, for example, about what sort of stimulation a person enjoys. Problem in the relationship, such as unsolved conflicts, lack of trust, anxiety about sexual performance, and dramatic experiences such as sexual abuse. Next is the origin of dysfunction. Disorder are varied. It can be organic, problem with the anatomy and physiology of the reproductive organ. The problem with the anatomy and physiology of the reproductive organ, it is relating to human sexuality, pregnancy, contraception, and transmission of sexually transmitted infection, including HIV, depends upon knowledge of anatomy and structure of function physiology of the female and male reproductive system. Paraphilic disorder, when it is when the urge or act lasts or less 6 months and is manifestation of clinically significant distress. Some of the common paraphilic disorders are as follows: exhibitionism, pleasure from exposing one's genitals to non-consenting people. Exhibitionism, it is a condition marked by the urge, fantasy, or act for exposing one's genitals to non-consenting people, particularly strangers. For example, the preference could be to show genital to prepubescent children, adults, or both. Next is paresthesia, arousal from non-living object, shoes, socks, body parts. Voyeurism, touching or rubbing one body to genital to non-consenting people. Voyeurism, it is a problem when a person has sexual urge associated with non-living object. For example, the object of fetish could be an article of clothing such as underwear, rubber, or shoes, and clothing, women's shoes, and women underwear. Voyeurism, it is a sexual arousal centering on the act of touching an unsuspecting a non-consenting person, breasts, legs, buttocks, or genitals, or rubbing one from own pelvic area or erect penis against that person, generally from behind. Next is pedophilia, arousal from children, prepubescent. It is an adult who is sexually attracted to children. A grown man who wants to engage sexual behavior with nine-year-old boy or girl is an example for a pedophile. Next is sexual masochism, arousal from actual suffering or humiliation. Sexual masochism, it is who experience sexual arousal in response to extreme pain, humiliation, bondage, or torture. Next is sexual sadism, arousal from actually inflicting or humiliation. Sexual sadism, it is causing pain, humiliation, fear, or some form of physical or mental harm to another person to achieve sexual gratification. Sadistic acts include restraint, such as ropes, chains, or handcuffs. Next is transvestic fetishism, for heterosexual males only. Arousal from wearing clothing by the opposite sex during sexual activities. And transvestic fetishism, a man who masturbates while wearing women's clothing may develop clothing fetish and becomes sexually aroused by merely thinking about wearing women's as transvestite and the behavior called transvestic fetishism. Next is voyeurism, observing other people engage in sexual activities. It is a person expectation of privacy in their name, a locker room, or a similar area. Watch a person engage in sexual activity without their consent, begin filming or photographing another person without their permission, enter an area illegally in order to watch people. That's all. Thank you.